I mean, even if everybody had great health care in America and wonderful insurance, we cannot afford the status quo, but you know that they don't. So we have health reasons why we have to do it. We have budgetary reasons why we have to do it. We have competitiveness reasons why we have to do it for our economy. So we will be, again, discreetly today we are talking, our focus has been on women, it's on seniors, it's on young people here in New Haven. Stay on your policy until you're 26, your parents' policy until you're 26 years old, giving young people a healthy start as they go out into the world. So again, we will have the drumbeat, better quality, more affordable to many more people in our country. And again, we will have a statement of what this bill is, so that those who want to mischaracterize it, now they will mischaracterize it, because no matter what the poster is, it could be pro-life, it could be whatever, socialism, it could be this, it could be that. Underneath it all, peel it off, it's the insurance companies. They had it all their way. We've been playing on their field for generations, and now it's time to play on the field of the American consumer. I just want to say something about how proud I am about my members. Rosa and John and others, some of our new members, Congressman Curiello of Virginia, Congressman Markey of Colorado, freshman members. Louise Slaughter of New York has been working on the issue for, I think, decades. Passed a bill on the floor of the House last week that ended the exemption from the antitrust laws for the insurance. Yes. 406 to 19. The leader of the Republican Party in the Congress voted against the bill, but nonetheless, 406 to 19. So again, we put down a marker. This bill will not be the last bill you will be hearing from. We do have to address long-term health issues. We do have to address documentation, because it's healthier for America for everyone to be in the loop. It cannot be, all of it cannot be done in this bill. It is to make it, Rosa, if you give me a number. When Social Congress, everybody gets an assigned time except the speaker can speak as long. No time limit. No time limit. I'm reading this book about Frances Perkins, the woman behind Social Security, and what a fight that was at the time. And again, the same people who were opposing that change, that sense of obligation from one person to the next, well, they're still with us. But in Social Security, when it first passed, the left was unhappy because they had another plan, something called the Townsend Plan. And it was not sustainable, but it was what they had wanted. And some people lost their election from the left, because the left defeated them because they didn't go with that plan, which again was not sustainable, but it was a good idea, I suppose. But it was not as good an idea of socialism. We're not just helping the poor, but it was a compact with everyone in America, so you could sustain a constituency for it. That's why you can't means test Social Security. Sometimes people suggest it's about everybody paying in, coming out, and not somebody doing a favor for anybody else. But it didn't cover teachers, people who worked in homes. Sounds like women to me. Like farmers. It didn't include a lot of people, but then it did. So you have to start. You have to kick open the door. And as I say to members, I understand that sometimes you want to vote against a bill for what it isn't, but we want you to vote for this for what it is and what it can lead to. And we all share that value, a sense of community in our country, our responsibility to each other. Again, a right, not a privilege. We're all healthier if everyone is healthier. And again, all roads lead from the New Haven and
going to ask you to stay seated. We're going to try to entertain some questions from the press. I would add one thing to what the speaker said. No one has to add anything to what she said. But today our focus is on, you're going to get out there and help to support health care. But I want you to hear from all walks of life here. You have great networks that include women. Women in this state, women in this country do not know all of the benefits in this legislation for them. You have to be, Tony, you asked, Susie, you asked, your voices are loud. Let them know that not to be afraid of this legislation, that in fact it will assist them in their lives, both in terms of their health and in terms of their economics. You've got to help us do that. We cannot do it alone. You're going to have to, once this passed, define this bill for everyone and particularly women. Thanks very, very much.
Rosa has also made another emphasis. I know we're focusing on women today, and that's very nice, the disparity. So, and your other are we going someplace else? Right there.
But we said we were going to entertain a couple of questions from the press, which we'd like to do at this time. Mary O'Leary.
Honors the principles that I set out. No federal funding of abortion, no expansion or diminishment of abortion rights, and again, a commitment to passing health care reform. We believe that the Senate language more than satisfies the needs of some of our members who are pro-life.
Speak up. Can't hear.
Well, we live in the world of a kaleidoscope. They're different people. The large majority of those people were Republicans. They're never going to vote for the House bill in the first place. They're not going to be there in the first place. And a number of people most of those people will be voting for the House bill. We feel very confident that, again, if the issue is federal funding and no expansion or diminishment, that the language satisfies that. John, did you?
Yeah, I would just say that there are, as the chairman of the caucus and listening to, first of all, the extraordinary work that both Rosa and the speaker did it. This was back in November the 7th. We passed this bill in the House of Representatives, and it was an extraordinary moment. And there were members then that stood and said, I'm in favor of the Stupak amendment because I agreed to sponsor it both in the committee and here. But I want to make it clear that if this bill comes back from the Senate, as long as Hyde is still the law in the land, I will be in support of that. And I believe that that's where the votes are, and that's why this bill will go forward.
And if I just may say one more thing, Rosa, and Rosa, this is not a bill about that. This is a bill about health care and health.
I want to say one thing. The speaker and John have characterized this, and I want to say we have our colleagues who are both pro-choice and pro-life who want to see health care passed. They came together in the House in terms of what came out of the Energy and Commerce Committee. They understand what happened in the Senate, and they want to pass health care, and they are not going to be pressured by outside influences to move them off that dime of passing health care in this country, because they're not going to hold health care hostage. They're just not going to do it.
You need more conviction, Rose.
Last question, anyone? Is the basic number 215?
216.
216.
Unless you know something we don't know.
Tell us, Mary.
216.
Michelle Turner, New Haven Independent. Madam Speaker, after a year of trying to pass health care reform, what have you concluded about bipartisanship in Washington? And is it possible for Democrats and Republicans to work together to pass health care?
Well, first of all, we all have an obligation to find common ground across the aisle. We go to Congress to do that. We don't go there to draw lines in the sand. We go there to reach out and try to find solutions that are good for the American people. And as I said at the time of the meeting last year and the meeting last week, if there's a good idea that's good for the American people, whether it's Democratic or Republican, whatever it is, we want to incorporate it in the bill. Whether or not the Republicans will vote for the bill or not. It doesn't say, well, if we put your amendment in, if it's good for the American people, it's in the bill, if we can afford it, of course. So again, we have an obligation to find our common ground. If we don't find it, though, we must stand our ground. And because we may not achieve bipartisanship, does not mean we will not pass a bill. And one more thing, this bill may not get a bipartisan vote, or may, I don't know if anybody will vote for it, but what we do know is that over 100 Republican amendments are in the bill.
Yeah.
And that we have moved from a public option to an exchange, which is a Republican idea. So what you're hearing from the other side is an excuse for not wanting to free themselves from being handmaidens of the insurance company. That's what it's about. Handmaidens of the insurance company. Any excuse will do not to vote for the bill. But I think it's more like 150 Republican amendments are in this.